Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I am Urvashi. Today we will discuss cosmetic limb lengthening with our expert Dr. Arvind Verma Jangir, who is an orthopedic surgeon, specialist in Ilizarov surgery, joint replacement and trauma surgery. He has done his training of limb reconstruction and deformity correction limb lengthening from King's Hospital, London in UK. He has also done his training in Ilizarov Research Center, Kurgan, Russia. He is a visiting surgeon at Alvaro Hospital in Spain. He is also visiting surgeon for limb lengthening and deformity correction in Baghdad. CEO of AOW Ilizarov Institute, Indore. Honorary Secretary, Indian Academy of Orthopedic Surgeon. Honorary Secretary at AOSI. He has treated more than 1500 Ilizarov surgeries and trauma surgeries. He is a specialist in the treatment of bone infections, non-union of fractured bones, and correction of deformities. Hello, Dr. Arvind. Welcome to our podcast for patients, caregivers, and healthcare professionals at Medica Talks.
Hello, Rusai. Thank you so much for introducing me, and very good afternoon to everybody.
Thank you, sir. So we'll start our podcast today. My first question to you is, can you tell us what is cosmetic limb lengthening?
Cosmetic limb lengthening is, a limb lengthening is commonly performed procedure for individuals with leg length discrepancies, that commonly known as LLD. We usually do limb lengthening procedures in sometimes you have one short limb, one limb is longer, one limb shorter, then we equalize both limbs. So that is known as limb lengthening. This limb length discrepancy can be congenital, since that can be from since birth, absence of fibula, short tibia, short femur, or that can be acquired like post-traumatic growth arrest, bone infection. When we do limb lengthening of both legs for cosmetic purposes, then this is referred to as cosmetic limb lengthening. Cosmetic limb lengthening is basically an increase in height of the person, for that we do surgeries in both legs.
So what is Ilizarov surgery?
Eligibility surgery is basically based on law of tension stress. This is well-known fact that bone, tendons, nerves, muscles, skin, and blood vessels, they all regenerate under tension stress, but that tension stress must be applied by gradual distraction, and the rate of distraction must be less than 1 millimeter per day, and that also be divided into 4 times, that is 0.25 millimeter every 6 to 8 hours, and that should not exceed 1 millimeter per day. This distraction is applied by a circular external fixture with 360-degree stability fixed to the bone with pins and wires, and this fixture is known as Ilizarov. This Ilizarov fixture was invented by Professor G.A. Ilizarov in Kurgan, Russia, where they have a big hospital. Everybody from all over the world, doctors are going for training purposes, and patients are coming from all over the world to the Kurgan, Russia for limb lengthening surgeries.
Okay. So who is a candidate for cosmetic height surgery?
In India, most commonly this limb length lengthening surgery is performed in patients with limb length discrepancies. In routinely, we don't perform cosmetic limb lengthening for height increase purposes, and for cosmetic height increase, we check for average height of the country. When you are going to increase height of the person, that is cosmetic limb lengthening height increase, the height of the person should be below average height of the country. For male in India, for male, this is around 5 feet and 8 inches, 170 centimeters, and average height of Indian female is 5 feet and 3 inches, 157.5. Age of the cosmetic limb lengthening to gain height is important. We can do any time after closure of growth plate. Everybody is having growth plate in their limbs. Until growth plate is not united, you can gain the height. Once growth plate is fused, then there will be no increase in height. So after closure of growth plate, we can do cosmetic limb lengthening. We can do it in some conditions like that. Short stature affecting mental illness of person, and sometimes few person comes to us, they are depressed for their short stature, and they desire to gain taller than they have already.
Okay, so what is the procedure for cosmetic height surgery?
Usually, we perform a kind of Ilizarov surgery for cosmetic limb lengthening, height increase purposes. We operate both legs together. We apply Ilizarov frame in both legs. We cut the bone, preserve periosteum and intramedullary blood supply of the bone. We cut the fibula, and Ilizarov operators helps in extraction of the tissue bone at the rate of 0.25 millimeter 4 times a day, that is equal to 1 millimeter per day. Regular physiotherapy is advisable to patients. They should have good amount of protein, calcium, vitamin supplements, and regular visit to surgeon. And we advise to stop tobacco and alcohol in any form during entire period of procedure, because tobacco and alcohol, they don't allow bone and tissue to regenerate.
So, how much taller can an individual get?
At a time, we can gain 7 centimeter for a single bone. Suppose that we have two bones in leg, one is femur, other is tibia. So if we operate in one bone, that is tibia below knee, we can gain 7 centimeter in one surgery. And in a small bone, sometime you have small fingers. For small bones, we can gain 2.5 centimeter in one time surgery. Beyond this, we check for resistance joint. Suppose that we are increasing the height and patient are not doing any physiotherapy, then they will have joint contracture, deformity. Then we have to stop distraction and finish the surgery at that moment.
What is the cost of the surgery?
Urvashi, cost of the surgery depends on so many things, like what kind of hospital you are adopting, what kind of ward you are using, general ward, private ward, deluxe ward, like that. We have a lot of a variety of implant, like titanium implant, imported implant, steel implant, Indian implant. So the total cost will depend on what kind of things you are using. Basic cost, if you are going for a very basic, use this cost around 2.5 lakhs rupees.
Okay. So, which bones are lengthened basically?
We can lengthen any bone. For cosmetic limb lengthening, height increase, simplest bone is to operate is tibia, both tibia, because if we operate both femur together, patient will not be able to walk. If we operate both leg, tibia, patient will be able to do his routine activities. He can walk, he can climb, he can swim, he can do everything.
So, what is the length of the stay after the surgery? Let's say I've done the surgery today. How many days do I have to stay for the surgery?
Usually 5 to 6 days, and that depends on if patient is having any complications like that, nerve injuries, vessel injuries, then they have to stay longer period. But if the surgery is uneventful, no problem, we can discharge patient in 5 to 6 days. We allow patient to walk by their own on their own legs, and once patient able to walk without pain, we discharge patient immediately.
Sir, could you please tell us the other methods of limb lengthening?
Yeah. Urvashi, nowadays, so many methods are available for cosmetic height increase, limb lengthening. Ilizarov is most commonly performed surgery for this purpose. Now we can mix it with nail. We can operate Ilizarov with nail to shorten the period of frame. We can do it Ilizarov with plate, and six. We can do cosmetic limb lengthening with use of TSF, Taylor's spatial frame. And nowadays, limb lengthening nails are available. Limb lengthening nail we fix inside, we cut the bone. They have auto distractor inside the nail. You have remote in your hand. With the use of remote, you can rotate the motor and you will get lengthening.
So, what are the complications post surgery that need to be taken care of?
Yeah, Ursi, this is very good question. Everybody going for cosmetic limb lengthening must aware of all these complications, because we are going to operate in normal person who is doing everything. He's physically, mentally, everything normal, limbs are normal. So everyone should be take care of all these complications. I can divide these complications into two categories. One is from immediate post-op complications. We can have intraoperative complication, that can be a injury to the vessels that will lead to bleeding, and sometimes we can get a very high pressure in the limb, that is known as compartment syndrome, and pain and late complication. These are very important. If you are not taking care of frame properly, you are not doing exercises, you are not doing physiotherapy, you will have complications like infection, pin tract infection is common. You will have pain, joint contracture and stiffness is very common, Urvashi, because we are distracting the tissues. So once you distract the tissue, joint adjacent to the limb lengthening, like if you are going to operate in tibia, you will have knee joint above and ankle joint below. So if the patient is not walking, not doing accurate physiotherapy, they will have deformity in ankle joint. Equinus deformity is very common, and knee flexion deformity. And sometimes people have post-traumatic stress that need to be taken care of. Sometimes we can get a deformity via a loose, the patient are distracting one side more, other side less, then we can develop a deformity, both planes, procurbitum deformity and varus valgus deformity.
What are other uses of Ilizarov surgery other than limb lengthening?
Yeah, Rusi, this is a very good question. Basically, Ilizarov surgery was invented for fracture, non-unions, bone infections. We are using it as additional advantage for cosmetic limb lengthening height increase. This is best technique for management of infected non-union and non-union with bone loss.
What are the other uses of Ilizarov surgery other than limb lengthening?
Yeah. Thank you, Rusi, for this question. Basically, Elizarov surgery was invented in the management of infected non-union. Safest way to treat infected non-union is Elizarov surgery because the thin wires used in Elizarov, they are resistant to infection. And they have very less trauma when we are going to operate with this technique. This technique is ideal for management of complex fracture, open fracture, cross injury. Sometimes patient comes with cross injuries, they don't have anything, but we will just after 2 to 3 days of surgery. And Ilizarov surgery is one most very good method for correction of deformity, both congenital and acquired. CTVs, that very complex foot and ankle deformity, in polio, bun contracture, any kind of deformity. This is best technique to use.
So, what message would you like to give to our listeners?
I would like to give message to all those people who want to get height. They are depressed with their short stature. Please don't feel so. You have a positive. You can have a positive attitude because short people maintain a great perspective on life because they are always looking up. So don't make it your weakness, but make it your strength, your positivity in the world. So many people with short stature did great work for society, for Earth. So don't think you have short height. Just believe in yourself.
Thank you, Doctor. That was a great line to end the podcast with. So, thank you for being with Medica Talks and sharing your insights on cosmetic limb lengthening surgery. The insights shared by you were of great value to us, and I'm sure that our listeners will also be very happy to hear all of the words that were shared by you. So, thank you so much.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.